But up next, we have some patients who are kind enough to share their experience living with FSHD. We want to thank them very much for being brave enough to share their experience with the group. So we have Chelsea and Laura, her mom. If you guys want to hop in and introduce yourselves, we can go from there. I believe they are willing to take questions throughout their talk. So if you have questions, you can put them in the chat, or we can save them to the end.
Thanks, Kylie.
Thank you guys very much.
Thanks for inviting us to be presenters today. And to all of you, I want to ask for your patience in advance. I live way out in the country where the internet speed is a crawl at best. So if I freeze or if the audio goes off or something, then Chelsea will just have to handle this on her own. I'm Laura Adams. I'm 66 years old. I'm retired. I'm active as a nonprofit volunteer and grandmother of grandkids that live too far away from me. I belong to your sister FSH Society chapter in St. Louis. And I am really delighted to be here today with my daughter. When they first asked me to do this, I have been told in the past that on my own, I'm just really not that interesting. So I was thrilled when Chelsea said that she would do this with me.
I was definitely roped into this, but happily so. And yeah, I think you'll hear throughout this that we're pretty good sidekicks. I'm grateful to have each other on the journey, and it's really wonderful to be here with each of you. Thank you for the opportunity to kind of share our story, and I think for me, sort of stretch some advocacy muscles, which I think is, I hope it's a big part of my future, something I'm certainly getting accustomed to now. But a little bit about me, I'm actually in Maine, so my mom is nestled in Missouri, and I'm over here on the East Coast. And I'm part of the Too Far Away contingent she referred to. I'm 38 years old. I have a daughter that is 3.5, and a new Newfoundland puppy. So we're very busy over here in Maine. And I work in development for an early intervention organization for kids with special needs. So that's kind of in a nutshell what my world looks like here. I'm just happy to be with you guys today and sharing a bit of our story.
So we decided to kind of divide this up into different sections. And the first one is to talk about diagnosis and my own experience. It wouldn't be out of order for Chelsea to start this part, so I'm exercising my seniority here, and I'm going to start it anyway. In my late 40s, I sought medical attention for hip pain and ankle weakness, and I was prescribed physical therapy. And that therapist said I had piriformis syndrome and gave me exercises and chiropractic adjustments. And when this didn't resolve the issues, I saw orthopedic specialists, and I had a battery of x-rays and MRIs and nerve conduction tests, and that uncovered a couple of bulging discs, which seemed to satisfy the medical community that that was the root of my problems, and that was unresolvable nerve damage. So at age 50, the shoes I'd always worn were no longer wearable because my ankles weren't stable enough, and some of them I couldn't even keep on my feet anymore. I had walked for exercise all my life for fitness and also for sanity. And I believed, ironically, that exercise was something I would be, or walking was something I would be able to do my entire life. But by my mid-50s, I wasn't walking for pleasure anymore. I could still walk, but I was not doing it for pleasure. So over the next 5 years, the problems that I had were bothersome and worrisome, but they didn't really interfere with my activities. I did take up a lot more space on the sidewalk as my shambling gait expanded the space I took up on the sidewalk. And my husband still pulls me over to the side so other people can use the sidewalk at the same time that I do. None of the health professionals I encountered in the 15 years that I looked for answers to what seemed to me to be a progressive condition ever mentioned muscular dystrophy. Chelsea, what was your experience?
It was the same in many regards. You know, it involved several specialists and a few years. And after all of that, about a 5-minute diagnosis, which was, of course, sort of jarring. I'd say I started to notice things when I was in my late 20s. I had some shoulder issues and had been referred to get the sort of electrode testing on my long thoracic nerve, which was my introduction to disagreeing doctors. So I had an orthopedist who sent me for this test. And when I got there, the orthopedist disagreed and sent me packing back to the referring doctor. So I kind of became this messenger of disagreement. And I also hadn't gotten what I needed, which is just an awkward position to be in when you're a patient. And I sort of let it drop after that because I wasn't totally impaired by the issues I was having, and I had reached or encountered this obstacle, so I just kind of let it ride. The next thing that I encountered was an inability to walk on my tiptoes, which was just something I did when I was kind of creeping across to the restroom at night, regardless of who I would be disturbing or not. That was just a habit that I had, and I realized one night that I couldn't do it. And I sought counsel. They sent me to a sports medicine doctor. My primary physician referred me to a sports med doctor, Dr. Chris. He was wonderful. He was patient, and he was very thorough, and he was funny. He referred me out for electrode testing on my legs, which didn't reveal much other than something wasn't quite right. They still didn't know what. I was referred to someone else who focused on vitamin D, and maybe I needed shots. There was talk about compartment syndrome. I saw a new physiatrist to get the nerve conduction testing on my shoulder. Everyone had a theory about a piece of the puzzle. And after about 2 years, Dr. Chris consulted a mentor of his who had been retired, who suggested that he kind of zoom out and, that look at the collective and something might be wrong with the system. And I remember Dr. Chris's favorite saying was, common things are common. And, on their own, each one of these things seems sort of simple, but they're not common in combination. So in 2011, he referred me to a neuromuscular specialist at Brigham and Women's. And at this point, I was in the best shape of my life. I feel like I can thank a tumultuous relationship for a newfound dedication to the gym. And I was like thinking of myself as an athlete with, the body stresses to show for it. I really had not gone anywhere remotely close to something like this in my head. So that's how I traveled down to Brigham and Women's with a dear friend of mine who kind of wandered the hallways while I went in and saw this neuromuscular specialist who literally did about 5 minutes of tests, like raise your arms above your head, walk on your heels, and then was pretty cut and dried. You've got FSH muscular dystrophy, and he rattled off some descriptors. It typically manifests in your late 20s or early 30s. It progresses slowly. You won't be in a wheelchair or on a ventilator anytime soon, which is, of course, when I shut him down with just a torrent of tears that neither one of us saw coming. But I feel like I remember it just being such a casual revelation, very matter of fact, and you're actually in pretty good shape. So there, I don't think he was intending to be insensitive, but so it was kind of a diagnosis and my first sort of confusing, unintentionally minimizing dose of perspective. He did not realize that I had no idea that this was a thing, let alone a potential reality for me. And this was his everyday. And I was probably, and still am, a pretty mild manifestation of the condition. So that piece of this puzzle in and of itself continues to be sort of a touch point for me, in that I don't really, I'm affected, but am I affected enough to really take ownership of being an FSH patient, or of advocating and speaking on behalf of or with those who are so much more severely limited. I don't really know how to inhabit this space quite yet. I do remember on the day that I was diagnosed, I walked out of the office and kind of into the flow of Brigham traffic out in the corridor. and felt like I was swimming upstream, and like nobody had a sense, because I was still completely mobile. I just had these beginning hints of a more troublesome condition, and like nobody had any idea. And I still feel that way sometimes during my daily life. It's something I deal with constantly, but it's not something that's really apparent to folks. And for the time being, that's probably how I prefer it. I feel like there'll be a lot of years when that's not the case. And right now that's how I'm more comfortable. But I remember even in all of that busyness feeling really alone. And I still feel that way sometimes in this journey, even though I've got a great sidekick here in my journey with my mom. So I had the blood test that afternoon to confirm things, and I left there just feeling like I didn't know much. I knew that it wasn't good. It also wasn't temporary. There wasn't a cure. There's no treatment. And nobody in my orbit knew what this was. So that's another piece of this pie where you kind of, in my experience, you are the expert in the room about your condition. And like Dr. Chris had never heard of FSH, and my primary care physician's not familiar with it. And there's not a whole lot of guidance or comfort to be found. So you really have to be your own advocate and your own educator when it comes to this. And that's a challenge not only with physicians, but I would say with some of my friends too, just in terms of, you're handing them a big reality when you tell them about something like this. And I don't always know the best way to do that. And I think the only other thing I'll mention before I turn it back over to my mom was that for me, this came at a time when I had really just gotten comfortable in my body and my own skin. And then all of a sudden it felt like my body had been keeping a secret from me, been harboring this news for a lifetime. And it really, it's a hard thing to reckon with. And it's still, those things that exist that you're unaware of. It's offered some interesting perspective and challenges for me at times. So back to you, Mama.
So I owe the fact that I got my diagnosis to Chelsea's. And after she was diagnosed, I was pretty certain that it was the cause of my issues. She remembers that I resisted that likelihood, but eventually I did make an appointment at Washington University with a neurologist, and he came to that same very abrupt assessment that Chelsea talked about with her Dr. Amato. And so he was certain about that. And Chelsea is so right about how lost and fumbling we felt in those first few years of knowing. There weren't any answers. There wasn't any hope. There wasn't anything to be done. So the WashU neurologist that diagnosed me thought that getting a genetic test was an unnecessary expense, and he would not order the test. So I asked my primary care physician to order it, and when the insurance company denied the $4,000 claim, I did appeal it, and eventually with the help of that provider, the insurance company paid for most of that cost. I have not been sorry that I claimed this FSH identity. I do know that the designation makes me ineligible for long-term care insurance. That's something that didn't occur to me when I first got confirmation, and that became part of my medical history, participating in research. What I didn't understand after that first diagnosis at WashU, and the fact that he really said there wasn't anything you could do, and I thought, well, then what's the point of coming back to see you? So I didn't go back, but I did find out that being connected with a muscular dystrophy association clinic is an advantage if you want to participate in clinical trials or studies. When I first started exploring the possibilities of that, I wasn't registered as a patient with a clinic, and I was told I couldn't be in the trial unless I was. So by the time the clinical trial that Chelsea and I both participate in started at WashU, I had established a connection with an MDA clinic at the University of Missouri Hospitals in Columbia, Missouri. And that clinic has steered me, well, they steered me toward the Resolve trial. And I'm grateful that I got to participate in that also. I had a recent, just my routine wellness appointment with my new young whippersnapper of a primary care physician. And so I got to tell him about FSH. He had never heard of it before. And what he did while I sat right in the room with him and he was behind his computer screen was what all of us do when we first get the diagnosis or hear about it. We Google it. So he Googled it and he's looking at this screen, the same thing that we saw the first time we did it. And no kidding, this is what he said. He said, "Ooh, do you want to know what the prognosis is?" And I assured him that, I already knew what the prognosis was. So my personal experience today, and this is just a list of frustrations from a typical week. I can't carry groceries from the trunk of the car to the kitchen counters without parking them several times along the way, climbing the steps one at a time, and then picking the bags up and moving them up again. I can't climb steps without pulling myself up with the banister, and that's both to ensure that I don't go backwards and to make up for the lack of strength in my thighs. Sometimes by the time I'm at the top of the flight of steps, my posture is bent over. I can't pick up Chelsea's 3.5-year-old daughter, my beautiful granddaughter. As I already mentioned, I stagger and weave when I walk on the sidewalk. I am a fall risk, having fallen, more than 2 or 3 times a year. I have very little endurance and exercise is increasingly hard to recover from. The weakness in my core means that I can't lift things that are below my waist to an upright standing position. One of my feet is curving from the imbalance of my musculature, which makes it really hard to fit a foot in a shoe. I still can, but I'm looking at that being a progressive situation also. And I don't spend every waking hour consumed by the fear that I'll not be able to take care of myself or that I'll become a burden to others. But the trajectory of FSH is one way. No amount of exercise or careful diet or other thing that I have any control over will stop or reverse the effects of the muscle loss. So that's a very scary thought. And still, I know that I'm extremely lucky. Among those with FSH, and Chelsea and I both are always talking about how lucky we are to be on our end of the spectrum of limitations. I have good upper body range of motion and strength. I can still smile. And even though I'm more intentional when I eat and swallow, those are things I can do with relative ease. And I appear to be healthy in every other way. So when we say that we're lucky to be on this end of the disability spectrum, it's kind of like saying, gee, I'm glad I only got hit by lightning once. So I'm going to turn the experience portion over to Chelsea now.
I noticed, like, while my mom was talking, like, I'm just like smiling and nodding, and it's not to make light of the list of things that we can all make that we struggle with. I think one of the resources that my mom and I share is an ability to kind of like find humor. When she's talking about herself, like ambling along the sidewalk, I mean, the pair of us together are just a sight, but we don't let it stop us from getting out and going places and still keeping a lot of optimism and joy. So she makes me smile both with her bravery and just sort of who she is. So thank you, Mom, for sharing that. So in my experience as a 38-year-old in terms of how this affects my daily life, at this point, I'm relatively minimally limited. I do wear AFOs. I have gone through several pairs of the Allard carbon fiber kind. I'm too active not to break them, but I'm limited enough that I need them. And of course, insurance will only pay for a new pair, I think like every 5 years. So that's been a challenge. I have the plastic cast versions too, that require you to wear the orthopedic looking shoes to fit inside, which it feels so petty and vain to acknowledge that that matters to me. And it does, it makes me feel ungrateful, which is just another way that FSH can sort of impact your self-perception. I'd say that the real limitations of the mobility impairment are making themselves known as my active 3.5-year-old daughter becomes more so. You know, mama can't run, mama can't play soccer, can't climb, can't jump for jumping's sake, because that's amazing when you're 3.5. We find workarounds, but that's, you know, it's certainly something that she notices and I notice. Like even now, I feel like I'm fighting not to be relegated to the sidelines of her adventurous life, and that's only going to increase the more involved she gets with things. And I certainly don't ever want to be the reason that she doesn't pursue things. So I'm gonna have to figure out a way to sort of message that for her and for me. A good chunk of the impacts do involve sort of me coming to terms with this self-perception, getting comfortable in my own FSH skin, both in emotional and an intellectual headspace. For a type A perfectionist like myself, an unpredictably progressive condition with no treatment really felt like some sort of cosmic joke. Like somebody better be getting a really good laugh out of this somewhere, because this is like, you know, this is just sort of, at that time, sort of my worst nightmare in terms of a condition. Anxiety over the unknown and what feels like an inability to influence the outcome is a sort of a subconscious constant current. It's wearing, even when you're not really tuned into it. I found it's difficult to know when and how to share my condition with other people, even close friends. You know, I have a tendency to want to minimize it and gloss over sort of the lifelong implications. I feel like when people hear progressive, if they really understand what that means, or they ask what the treatment is and learn that there isn't any, they're understandably sympathetic. But I often, you know, find myself minimizing it again to help make them comfortable. Because how do you respond to something like that when somebody says that to you, even though you in many instances seem like you're fine? You know, it's a tough thing to rationalize. So in terms of physical limitations, I'm starting to have trouble reaching the back of my head. You know, I kind of duck forward to wash my hair, often need help fastening jewelry, clasps, or tying bows on shirts. Everything is sort of ill-fitting. You know, my stomach domes, my calves swim in pants while my quads remain the same size. My shoulders wing, so my shirts need to have ample room in one way to get them on, and then ample room in another to get them off. I wouldn't say that I consciously engage with my diagnosis every minute of every day, but it does impact every minute of my life. You know, I don't look up the way I used to take in the world around me. I need my eyes for my feet. And I've got to think about every footfall, and I have to consider where I'll encounter stairs, and will there be a railing? Can I attend this meeting without having to out such a personal, sensitive aspect of my life to virtual strangers, just to explain why it's taking me so long to get up the stairs? I would say that the biggest impact on our life so far is how it impacted our family planning. So we were fortunate, my husband and I, in a couple of ways. One, in that we knew about the diagnosis before we started having children so that we could make some choices. And two, that we were incredibly fortunate to be able to make the choice to do IVF and genetic testing, to give our child the best shot at not inheriting the gene. And I'm acutely aware that that's not a path that everybody has the option to take. As my condition has progressed, it's become clear that I'm not really a good candidate to carry another child. I'm a fall risk, and you know, even holding another baby, you know, through those amazing infant years would be tough. So our best route to another child is surrogacy or adoption, and those aren't super accessible options either. So we're a trio of 3 and a puppy, but we hit the jackpot with the 1 kiddo we have. So we're really, really grateful. In many ways, my mom and I were talking about this the other day. I don't feel like I think about the future because there isn't much that I feel like I can do to alter or anticipate the outcome at this moment in time. I can participate in research and clinical trials, which I am doing to the extent that I can. My mom, I used to give her grief about this, but she brought me up to not dwell in places where it's unproductive. So living today with the way that I can feels like the best way for me to make the most of life. If I do think about the future, it's geared more towards our daughter and how I can support her in pursuing anything she might want to, and empower her not to be limited because of my limitations.
So I think our next subject was outlook. And my comments on that are accepting that you aren't as able as you once were is really hard, no matter what the severity of the loss is. It's lonely, even if you have a fellow traveler on this journey like I do with Chelsea. When you have noticeable limitations, you start to curtail your commitments because you don't want to slow others down, or you don't want to appear afflicted, and that really does change your world. So you have to begin to think about accommodating your disabilities, and that's a big step. Is it time to, renovate your bathroom or put a railing on the patio steps? Or should we invest in a dumbwaiter to get the laundry up from the basement? Or should we just skip that step and figure out how to afford an elevator? I do find that being part of the research and the fundraising that supports it to be cathartic. Being part of this presentation and sharing this time with people who know and care about FSH really feels hopeful. We're so grateful for the people and the companies who are working on the very promising breakthroughs. I'll probably be 70 by the time there's any gene editing therapy available, and maybe it won't help me, but I hope it helps Chelsea and every other young person who's scared about their future. So what would meaningful progress mean to me? It would mean no more episodes of muscle loss that you can almost feel happening. The extreme weakness and fatigue, and it does seem to it's episodic, the muscle cramping and aching, and it never feels like you rebound 100% from those episodes. So that would be just that stopping the muscle loss would be progress. And also progress more practically in developing braces and orthotics that are affordable and custom devices that are less obtrusive, easier to wear. One size does not fit all. Advancement in lightweight and durable materials. A way to try off-the-shelf devices so that you don't wind up with expensive braces and orthotics that you will never wear or use. Prescribing and insurance coverage of holistic approaches. Someone talked about, Terry, I think it was you, talking about those various things that your physical therapist has tried. Massage or yoga or aqua exercise or physical therapy, whatever else brings relief and maintains physical function. It would be helpful if the insurance industry and the medical field understood what those things could do to help us maintain the most function that we can. Education for the medical community, so it doesn't take years to get diagnoses, and also so that you aren't sitting there across from them when they say, ooh, do you know what's going to happen to you? Of course, a cure a cure is the highest level of wish. And treatment, once the muscle loss is halted, because I feel like that's going to happen maybe first in the field of research. They're going to figure out, possibly with the Fulcrum study, how to stop the muscle loss. Well, once it's stopped, you know, we are where we are in our disease progression. So what can be done? What therapies can there be to either compensate for the muscle loss, or will there be regenerative therapies that come along? So I look at the people with whom I share this diagnosis, and I'm just in awe of how everyone copes. That includes Chelsea, whose defiance of the impact on her life is a model of bravery and resilience. Meaning and stopping her muscle loss now so that she can build from where she is and not wonder how much more FSH is going to steal from her. I just want to wrap it up by saying thank you so much to Dr. Statland for all the hours that he spent answering my questions about everything. He and the staff of the Resolve study have always been so great. They express so much gratitude for my participation in the study, and that contributes to my satisfaction in doing it. Everyone there has been really patient and kind. Thanks to all the researchers and drug companies for working to deliver relief, and the other vendors, you know, companies who craft ever lighter and more dynamic braces and walkers and wheelchairs, the architects who work on making accessibility beautiful and standard, fashion design, shoes, and all that. To all of them, please keep innovating. Thanks to the FSH Society, Mark Stone and June. They don't know me, I feel like I know them, but their support for our chapter organization and all of the fundraising has just been invaluable. There's so much hope in their determination and their aspirations. And thanks to everybody who's on here today and listened to this segment. As Jessie mentioned in her question about the standing frame, you have to advocate for yourself. If you aren't advocating for yourself, Chelsea and I sure hope that you'll think about doing that. It shouldn't be as hard as it is, but that's where we are right now. Every bit of progress will make it a little easier for the next FSHer. And keep pushing solutions to your individual issues. Ask for help, educate people, participate in an FSH chapter or a clinical trial or a study if possible. And Chelsea, thanks most of all to you for doing this with me today. I wish we weren't in this.
Well, I don't know if I'm supposed to say anything now that I told my mom, I said, how are we going to get through this without crying? And I barely did. I don't really have any closing sentiments. I'm so proud of my mom. I guess that would be one. And I saw some of the comments coming through on the side chat, and just wanted to say thank you to those of you who added some little notes in there and the encouragement along the way. We'll take questions if there are any.
Yeah, definitely.
I have
Thank
a question.
you so much.
Chelsea, do you think that your pregnancy accelerated any of your muscle loss?
It's a good question. I loved being pregnant, and I felt great until like the home stretch when nobody loves being pregnant and nobody feels great. I don't know that it made things worse per se, but I do feel like there is a hormonal link between my weakness and when it flares up and down. But I don't know if being pregnant actually made it worse, or if, you know, I was I was engaging in life a little differently after the arrival of our daughter, and being asked to do things with my body that I hadn't been prior. So I don't know, Mom. I'm not sure about that. It's a good question that I don't really have an answer to.
Okay, I want to thank both Chelsea and Laura. Thank you guys so much. I really appreciate your sharing, and I thought that that was really quite effective.